You stay late hours. I was just saying, you stay late hours, all of you. Well, good evening, everybody. Thank you very much indeed for staying late on a Friday night. So the meeting of the Security Council that has just concluded included speeches from at least 18 participants, together with briefings from 3 of us, 2 from the United Nations and 1 from the French Red Cross. I'm now going to give you a short statement. Listening to members of the Security Council, it's clear to me that they perceive this Ebola outbreak to be a major challenge for humankind, for all governments, for the people of the affected countries, and for their economies and their development. The speeches that were made expressed concern about what this outbreak is and what it could become. And there were many statements made that showed real concern and empathy with the countries and communities that are affected, together with a real wish that there is strong preparedness and support for countries that are at risk of infection. They identified the virus as unforgiving and unkind, a virus that can hurt everyone, whatever their nationality, their faith and their age. And they said it requires a massive and sustained response. But there was a recognition that transmission of Ebola is slowing in some places, and this gives us hope. Where the response strategy is well implemented, transmission is decreasing. And we know why this is happening. If the response can be accelerated and maintained, the outbreak can indeed be contained. But unfortunately, results are uneven among and within the countries, and the new chain of transmission in Mali is a cause for deep concern. We are translating the lessons that have been learnt already into a sustained response, an intensified response in Mali, and the Secretary-General has instructed the head of UNMIR to establish on an urgent basis a United Nations support mission for Ebola emergency response in Mali. This meeting of the Security Council reflected on the global response to Ebola and identified work not just of the United Nations, but of the African Union, the European Union, partner countries, non-governmental organisations and others. There was a recognition that more international responders with a mix of skills are needed. There was a recognition that travel bans, quarantines based on nationality, and isolation of countries does not actually contribute to the response. Many statements talked about how stigmatisation should be avoided. There were discussions on the level of financing already made available and the fact that some resources are still needed. But there was also recognition of the generosity of nations and the likelihood that if there is a continuing shortfall, that will be met. Even as we're focusing on the immediate threat, many of those who spoke talked about the importance of also focusing on recovery, managing risks and threats and challenges now so that the recovery will be less massive and less painful, and at the same time ensuring that when recovery does happen, it's swift and strong, getting countries back onto the path of development quickly. The United Nations was identified as having a crucial role in this response. It can and will make a difference. And finally, the words that were most commonly stated that I was hearing all the time: maintain the momentum, be vigilant, persevere, be flexible, hunt down the virus, serve the people, and most of all, make sure that this outbreak ends as quickly as possible. Thank you.
About Mali. I wanted to, some people are reporting that of the 6 reported cases, all have resulted in death. And I wanted, is that misreporting? How many, does the UN have any idea how many people have actually have Ebola in Mali? And what's the mission going to do when it gets there, given what seems to be a pretty high death rate?
My understanding is of the 6 reported cases, all have been associated, unfortunately, with death. We continue to follow up contacts of these people to see whether or not there are others who are developing Ebola. This is a very active process and requires daily meetings with those who are under surveillance to see whether they're still ill. So see if they fall ill. So task number 1 is to maintain the contact tracing at full intensity. Task 2 is to prepare society for the possibility that there may be further cases of Ebola either appearing or being introduced into the community. Task 3 is to prepare all the health systems so that they are ready in case there is a possible Ebola case. Task 4 is to put in place the potential preparations for treatment centres. Basically, the plan for UNMIR is to make certain that all the different external and internal forces of the international community, all the different programs of the international community are ready so that if there are further cases in Mali, they can be dealt with immediately. We do not want the virus to become established in that country.
Do you have any specific ideas on how to scale up the international response? Do you plan to ask the other UN agencies, for example, including the peacekeeping missions, to do more?
Are you talking about Mali specifically?
I'm talking about all 4 countries now, because you've heard the Security Council say more international mobilization is required.
So the first thing to say is that there are very many offers now of people to come in to be supporters of the response. We've had the African Union offering several hundred people from individual countries, particularly from Nigeria, from Democratic Republic of Congo, and from Kenya. And so one of the very first next steps is to make certain that it's going to be easy for those people to come in and work in support of the national responses in all the affected countries. Number 2, the existing work of the United Nations system is really getting into a very high gear right now with UNICEF, the World Food Programme, the World Health Organization, as well as, of course, UNMIR, the United Nations, UNFPA, Population Fund, and indeed other agencies within our system, all at the stage now of ramping up the number of staff they're putting in. Thirdly, we are going to see, I think, increased contributions from member states, both to the Trust Fund and to the overall response. Fourthly, I do believe that there will be, in Mali at least, strong involvement of the MINUSMA, the peacekeeping contingent there, in order to make certain that that response is as strong as possible. My anticipation is that during the next 2 or 3 months we will see many hundreds of more staff come in from our system to support the response, particularly at district level.
What are you asking MINUSMA to do?
Well, MINUSMA's role in particular, their support in Mali, has been, number 1, to work to enable, to support the case-finding work that's been done as a result of the initial cases and contact tracing. MINUSMA people have been participating in that process. MINUSMA people are participating also in a lot of the preparedness work, with social mobilization work, and the other thing that MINUSMA is doing is linking up with the rest of the UN system on all aspects of the preparatory work throughout Mali. This is, of course, MINUSMA working in a supportive civilian role, not in a military role.
Of those people who are being monitored in Mali,
yes,
who had contact with the imam,
yeah,
how many people are there, and where are they concentrated?
Well, the total number of contacts, the latest figure I have is around 600, and they are quite widely dispersed throughout the country, obviously principally in Bamako, but not entirely. I haven't got a map at my disposal to tell you where they are. And what I can tell you is the statistics we look at, how often are those contacts being met? Are they being followed up every day or not? Currently, they've been stratified into contacts that are considered to be particularly high risk, and they're getting more intensive monitoring, and others that are much lower risk that are getting less intensive monitoring. But it is an absolutely massive exercise underway right now to try to keep them under daily surveillance.
And what is the status of the 23 peacekeepers who were at the Pasteur clinic? Have they been released?
No, they are still very much under surveillance at this time.
Are any of them sick with Ebola?
I have no information on that at all.
And apparently there was another peacekeeper who had left the clinic and went to Kidal. Has that person been traced?
That, again, I'm not able to comment on.
Thank you.
Thank you for that interest.